Is it? Oh, there it is.
This meeting is being recorded.
All right, she just told us that we're being recorded. Okay, everybody, wait a minute, just, hi Jody, I haven't seen you in so long. Okay, so I'm gonna present my screen again, I'll start over. So as I was saying, I'm really, the goal is to ask questions. I can see in the audience, there's actually quite a lot of people in this room who know a ton about Medicaid and New Jersey Medicaid. So while I'm going to do the presentation, I am not the only expert here, so we can grab some information. So I'm going to start really quick with I wanted to start with an overview of how you become a doula with New Jersey Family Care. So we're just going to start with this quick overview. This slide deck, I go through this in a lot of detail in a presentation that we recorded, that Shani and I recorded, so that will be available as well as today. So if you have more questions, more information, but we have to start at the beginning to make sure we all know where we're headed, right? So, so you want your doula services covered. All right, that sounds great. So the application for New Jersey Family Medicaid, the really important thing to understand is that there's really two parts. The first part is fee for service. That's what we're going to talk about first. Then the second part is when you become credentialed with each managed care organization. So so that everyone understands how Medicaid works, is that in New Jersey, everyone who gets Medicaid immediately joins the fee for service group. So it's the group, it's the catch-all, everybody's on fee for service. But very quickly, depending on how fast the state is moving, you are moved to a managed care organization, or you can sometimes choose your managed care organization. So the step to become involved with any of the managed care organizations is you have to go through this fee for service process first. All right. And really, if you have questions, please raise your hand, ask them, put them in the chat. Don't let me, if I say anything that's like initials or, and you're like, what is she talking about? Please ask. Because sometimes those of us who live and breathe this, we kind of forget that not everyone walks around saying MCO and things like that. So please let me know. So just to start with, within New Jersey Family Medicaid, I'm sure most of you, if not all of you, already know this, it is limited to specific doula training organizations. So those are listed on this page, and you're going to find your doula training organization, and then you're going to remember the color page you're going to go to, right? So if you were trained with Health Connect 1, then you're going to go to the green page. But if you went through Ancient Song, you're going to go to the blue page. Make sense? Okay, so it's really important. Now, one of the things that the New Jersey DLC is working on is providing advice and feedback to the Department of Health around which training should be included in New Jersey Medicaid. So if you have a training that's not listed here, please email the DLC, the email, I'll be giving it later too, and let us know, where did you train? What's their website? So that we can start, and I'm using we to be very global. The Doula Learning Collaborative is organized by Health Connect 1, and currently it is being led by Danica and Jody, who are both on the call, so I can say hi. But we're collecting that information, so know that. So then, and again, this slide deck will be provided. Now, this is a list of, so if you're not trained yet and you want to, here's a list of trainings. I know that, Danica, I think I just saw you post that you guys are doing a free training in Essex County right now. So there's doula trainings available. There's funds that are being leveraged to get more doulas trained in New Jersey. So there's both pathways, right? We're working on adding trainings, but we're also trying to get more doulas through the trainings. So pick the path that makes the most sense for you. So remember, now you have to remember your color. So what you're going to do is when you do fee for services, you're going to go to that first page, find your color page, and you're going to go there and you're going to complete all of the sticky notes on that page, right? You're going to make sure you do all of it. And then you're going to go to the yellow page. So each training, because each training is different, and because some of the trainings include workshop on HIPAA, which is, the Health Information Portability something act. It means privacy, the privacy of your information within the medical care system. That if that's included in your training, your page will look different. Okay, so just don't worry about anybody else's page, right? It's like when my kids were little and I would be like, don't worry about your brother's work, like do your work. So you stay on your page. And then, so we have green, we have blue. This is for Ancient Song doula services. So as you can see, Ancient Song, as for example, they're not doing the HIPAA class because they already have it in their training. And then the purple page, okay? So once you have all that, then you're gonna go to the yellow page, which is where we're gonna pull it all together. This is a really important page because what we found over time is that the number one reason that doulas are not getting their fee-for-service application is because when it gets turned in, it's not complete and it gets mucked up in the system. And in case you're wondering what doulas I'm talking about myself. Okay, so like I did that. So it's not everybody can do this. So you're gonna pull everything together. And then it's really, really important that you're gonna email the application to 2 locations, right? It's this bottom middle right here. Make sure you're sending it not to the NJDLC provider enrollment, and then also to the doula guides. There are staff members working inside DHS whose job it is to support the doulas. Well, it's not their only job, but part of their job is to support the doulas going through this process. So make sure you send it to both, okay? And then you're gonna get an email to complete your background screen. Just to really quickly cover, this is not a quick process, okay? This is not like a week or even a month. This is gonna take time. So if you're really, really excited, that's awesome, but just look at this and really give yourself enough time to complete the whole process. So, we even included your training in here, which can take a longer time, but knowing that if you turn in a complete perfect application, it's supposed to take 30 days. I did not turn in a perfect complete application. So mine took closer to 90 days to get back that fee for service number. So just be aware that this process is it's just going to take time. And we're trying really hard with the DLC to see where in the process we can slice off time and where we can smooth things out. But we're also dealing with, the BMF that is New Jersey Family Care. So there's places where it can move and there's places where it won't move, where that barge is like stuck. So, and then the next step is you're going to contract with the MCOs, the managed care organizations. And that's really what we're here to talk about today. So thank you for letting me give that precursor, because we're really here to talk about those managed care enrollment and contracting. So I know I've given a lot of information. Does anybody have any questions right now at this point that they would like addressed before we move on to MCOs? And Shawnee, I can't see the chat because I'm just not that skilled. So let me know if there's anything that I need to be addressing. Well, actually, wait, I just saw it. So Michelle, yeah. Oh yeah, Shawnee said it. We'll do it. Yes, Michelle, did you have a question?
Yes. Good afternoon. Thank you for your presentation. I do have a question. My background is in the medical field. I already have HIPAA training in my field as a healthcare professional, and I have first aid and CPR. And in addition to my background, I have trained with a doula program that is one of our sister states, which is New York. My question is, what steps can I take to make sure that the New York training is accepted in New Jersey? Can you please explain the process?
I will do my best. I don't know that we don't know all the steps in the process yet. And Joni or Shani or Danica, anybody else who feels like they can better answer a question can always jump in, but basically we want you to send that information to the DLC. And we're creating within the Doula Learning Collaborative, there will be a work group working specifically on adding trainings or recommending the adding of trainings because the decision sits with the Department of Health or DHS. Is that Department of? Yeah, sorry, I work in a lot of states and they all like their acronyms are just like slightly off.
DMAS, Department of Health and Human Services.
Thank you. See there. Thank you, Denise. I like how you're not taking the other question though. I see you. So send it over and and then they're going to be collected and submitted. Am I speaking correctly to what really is the process? Joni, anybody? Danica? Nodding heads. Okay. Yeah.
I just wanted to add, it really does just depend on like which training that you took in New York. Jody put in the chat, if it's one of the orgs on the short list, it does not matter. With a few international organizations, there may be a supplemental training. So it really just depends on which training. We might be able to help you out with this specific scenario during office hours. So I'll drop the information for that.
Okay,
That's a
thank
great
you.
one.
Appreciate it. Thank you.
And Shani, can you drop the email address for the DLC in the chat too?
Of course.
So that everybody has it? That would be great. But yeah, that is one thing to mention is that Shani and the team have these amazing office hours that they're offering I think it's every week, right? You guys do it every week. Yeah. They're fantastic. Twice a week. They're often, kind of like there's not a lot of people there. So if you have any questions or concerns, or you just want to be like, wait, I think I understand this, but I'm not sure. It is a great resource to take advantage of. Everyone who I'm naming on this call, we're all here to support New Jersey doulas in whatever way we can. So, don't hesitate to reach out. Don't get stuck in wondering or hear something from another doula and believe it and not sure if it's true. Please ask, because that's really what we're here. We're trying to really demystify this process that is quite complex. So, and we're not afraid of being like, I don't have any idea. So we're willing to learn with you if we need to. Okay. Okay. So this is, and as we said in the chat, these slides are going to go out, but this is a really important list to have. So these are the list of the managed care organizations that work within New Jersey Family Care. So just to remind everybody, when you go through Medicaid as a doula, you're first going to do that fee for service. Those are all those pages, the colored pages, and then the yellow page. And then you'll get your fee for service number back via email and a letter. So, and then you're going to go to these managed care organizations. Currently, the system is that you need to go to each one and apply to work with each individual one. So you email each one and you work with each one. What we're here to talk about today is a secondary process that is going to be available to doulas. So option one, you can see here, is really where you bill New Jersey Family Care as an individual provider. So you're going to go and get your individual MCO contract. You're going to see the clients that you want, and then you're going to bill. The DLC, we're here to support you in that process. We can help you troubleshoot as you go through that process. We, are here to tell you a lot more about it. But unfortunately, one of the largest stumbling blocks in all of this is billing. And billing is really complicated. And when you become an individual provider, you're really going to need to become a billing expert, because you're going to need to use different systems in order to bill each MCO. It is not, it's not unsurmountable. It's just a lot. And some people really want to know, they really want to get in there and they want to go to each MCO and they want to learn Availity and Trizetto and these clearinghouse systems. And if that's you, that's awesome. We will definitely support you at the DLC and help you get that, get organized for that. But for a lot of us, myself included, it's really nice to have some of that work not have to happen so that we can do other things with our time. So if that's you, then you're going to sit in either option 2 or option 3. So option 2 is that you can join the DLC doula group. So what that will look like, we'll talk more about it, but it is joining as an independent provider. You're still independent, but we're going to work together to use the software that the Doula Network has created to manage referrals, to document our time with our clients, and then to bill. So the third option is that there are other groups in New Jersey who are also becoming family care community doula groups. And so we will, that information to you. So if you're like, I'd like to do this, what are my choices? The DLC will have a list. So we can say you could join the DLC group, you can join another group. I don't want to name anybody yet because I know that there's one group that's working really hard to do it, but I don't know if we get, oh, great, Karen, Karen just asked about reimbursement, and I'm going to show you that slide. We have it all laid out for you. So, but first, let's just go through what it looks like to be in the group. And then Karen, the next slide is, and again, these slides are going to come out. It shows you the rates and the percentages. So what it looks like is that we're going to go live. Oh, Irina, do you want to ask your question before I do this slide? Or no,
Sure. Thank you,
Okay.
Elizabeth. I just had a quick question. So the partnership is planning on hiring 2 full-time doulas. So we are applying as a doula agency, and I have my team here, Namalini, who's our Medicaid biller, and Angela Lessa, who's the community doula supervisor for one of the doula programs. So we are going to apply as a doula agency. However, the 2 doulas that we hire can, on their own time, do independent work, of course. So would they be able, and I'm thinking about the doulas, would they be able to fit in 2 categories, like under the resource for DLC for our organization, and then they being independent providers under option 1 or 2? Is that an option
It is.
for them? Okay.
It absolutely is. Like you can, it's a really good question, Irene. And what I'll say is that as a doula, when you're an independent fee for service provider, you can be in like multiple groups. You could be in one group, you could be one group and be independent. So you have a lot of options the way that they've set this up, right? You can be in a group and then you can leave the group, right? So it's up to the doula to decide what they want to do.
Okay, I just wanted to make sure that only because they were hired under us, that there would be no restriction, otherwise if, when they do their work independently.
Yeah, no,
Okay,
I mean,
perfect. Thank you.
we just, they would have to have separate, like obviously separate clients, right?
Of course,
So, yeah,
absolutely.
makes
All right,
sense.
thank you.
It's good to see you. By the way.
Good to see you.
Oh, Adrina, I hope I pronounced that right. Do you have a question?
Yes, thank you. My question is kind of related to the question that was just posed a few minutes ago. So I am contracted through the MCOs. My specific question is related more or less to Horizon. I'm also was part of a doula group through Children's Futures as well. However, Horizon is advising that the tax ID numbers must, like, in order for me to have like individual clients, the tax ID number must be my own and it can't be as part of a group. So I'm not sure if you can exactly speak to that, or if any other doulas have run into that issue.
Yeah, say that one more time, because I think the Horizons is correct, but I want to make sure I understand what they're saying. Will you say it one more time?
So basically for me to practice as an independent doula, I have to change the tax ID number to reflect like my own tax ID. Like say if I have like a doula business, I have to have it reflected under that tax ID and not under, Children's Futures, who I also work with. So I think some doulas may run into this issue as far as whether or not we can still take on independent clients. And I just wanted to see if that was, kind of brought up in discussion.
Yes, and if anybody else has further knowledge, feel free to, raise your hand and jump on. But basically, you would want to, if you're working independently, be under your own tax ID. And so if you haven't formed an LLC and received a tax ID, then it would be under your social security number that you would be working. Does that make sense? And then if you're with a group, the billing will be under the group's tax ID, but with your NPI.
So, okay, so just to clarify, so we only can use one tax ID number?
No, you
Or can-
will, no. Like, so if you're
Because-
independent, sorry, go on.
No, I was asking because I do have an LLC. So I have my own tax ID number. However, there's an issue as far as me submitting claims, independently. They're basically saying I either can have one or the other. I can't have Children's Futures tax ID number, or I have to basically pick one or the other.
Sean Vay or Joni, were you gonna comment on this or do you have something else?
I was going to comment on this. So when you are working for Children's Futures or with the agency, are you working under them and they're assigning you clients and then they're doing the billing for you?
So
Or are
yes,
you-
it's both. So I do both. So I can take on independent clients and do my own billing, or I also take on clients with them and they do the billing.
So I think when they do the billing for you, they should be billing as a group and utilizing their own tax ID, and it shouldn't interfere with you taking on your own clients and doing your independent billing. So you should be able to go into their system and just have clients under you as an independent person, an LLC, and that's submitting bills. But for them to submit claims, they should be submitting claims using the group a tax ID number, if that makes any sense. Like they should be two separate entities. So I guess I would just be curious as to how Children's Futures is submitting the billing, because it shouldn't be causing an issue for you. And we can have that discussion like later or during office hours. It's not something that you necessarily need to have out in the public. But I would just be curious as to how the billing is being submitted and why it's causing an issue, because the two shouldn't cause an issue.
Thank you.
Yeah, I think we can, if we want, we could schedule a little time after this, even just like 15 minutes. And I'm happy to reach out to, the contacts at Horizons and see if we can get a better, if we can't like dig in and figure out exactly what's going on. Because sometimes that's, in these things, it's a little bit complicated. And with Doula being a new service, sometimes we hit rejections or we hit exclusions that shouldn't be there. And unfortunately, the only time we know that is when it happens. Right. So I hate for you to be that if that is what's happening, which I don't know if it is, I hate that we have to like just figure it out, but that's kind of unfortunately how the system can be crafted. So let's connect, with whoever after this. Does that sound good? We'll see if we can't figure it out. Okay. So that was really good. Thank you. Those were really good questions and really clarifying, really important things. So in the DLC Doula group, so we're targeting to go live November 1st. We're waiting for one more contract to come through on our group. So, but that is the plan. Then within that, you'll be able to utilize our TDNX software. And I have some screenshots of it in a little bit, and Luce can speak more eloquently to it. But in it, we have the ability to do client communication, charting, or documentation. There's the ability to reach out to the TDN staff for support if you need it, billing, and then the payment is direct deposited. And the software is being paid for by the Doula Learning Collaborative. So we're going to be able to use it for all your Doula clients. So if you want to use it for your private Doula clients, as well as your New Jersey Family Care grant doulas, that's fine. Like you can put all your clients in there, so you only have to utilize one system, if that works for you. We also have an online doula group, which is on a software called Band. So, for asking questions, for getting support, like, hey, I'm at the hospital. We've been here for 6 hours. She's still at 7 centimeters. Like, what positions do you suggest I try? She has an epidural, like those kind of things, or, or afterwards too. And then, of course, there's the DLC support team and ongoing education through the DLC. And those bottom two are going to be available for everyone, whether you join this group or you don't, because this is just an option, right? This is one way that you could work. So Karen, here's the slide that you were asking about. The fees. So the DLC is going to pay the monthly software fee, and then we are going to collect an 8% billing fee. And that is going to support, I meant to change these. It does not support the current DLC staff. The idea is for it to support the future sustainability of the DLC. Like right now, the Doula Learning Collaborative is supported by a grant. That's awesome. Everyone's really excited about doulas, but eventually we would like it to be its own entity in New Jersey where it's standing on its own, supported by everyone who's already there. So that DLC supports DLC staff is actually incorrect. I forgot to change that. It's really to support the future sustainability of the DLC. So in what we did here is took all the New Jersey reimbursement rates, applied the 8%, and then right here is the doula payment. So it shows what you would be paid. This is what's billed, right? The reimbursement rate. This is the 8% that stays, and then this is what comes to the doula. And it just kind of tried to build a couple different scenarios. So, you know, the standard doula care, which is what New Jersey, the state calls it, and that's the 8 visits. There's the extended care, 12 visits if your member is under 21. And then I just made up this word. I'm calling it the abbreviated doula care, knowing that in a lot of the other locations and states that we work in, we find that, you know, 4 visits is often 4 to 5 is kind of what doulas are doing. So I just wanted to be really transparent that within New Jersey, with the reimbursement rates as they are set, if you're only doing 4 visits, this is what you receive as a doula. So it's just important. I always like you to know, I feel like money can get really sticky. So I want to be really clear about it. Does anybody have questions about these numbers or anything? Again, it'll come out to you. Okay. So down under next steps is what we talk about, like kind of when we dream, what can the DLC do? So whether or not you want to be a part of this group or you just want to be a part of the DLC, either way, we want you here. We're so glad that you come to these lunch and learns. We're so excited about the enthusiasm in New Jersey, because really what we're hoping to do is like build a voice together, like a collective voice where we can go to the health plans and talk about the possibility of getting referrals like sent over or negotiating rates or even changing some of the process that we're currently in. And so all of those conversations would be future, and they can only happen if we have enough, right? If we have enough of a voice. So being here today is amazing because it really helps to start that unified voice around doula in the state of New Jersey. Okay, so the software. Dun, da, da, da. Don't worry, this isn't a real client. So that's Luce's email on there, who's on the call as well. So I just wanted to give you a quick glimpse into what the software looks like, and to talk a little bit about how it's formatted so that you're aware. We will be doing full onboarding to the software if and when you join the DLC group. So that's gonna come. Today is really just to get you like a starting view. So the way that it works is that you can go onto the Doula Network website and you can pick refer to doula services from our drop-down menu and fill out that referral form for your client. There is a group that is called the NJDLC. So that is where all of the clients for this project will sit so that we are able to run, you know, data and analytics and fund reports and all sorts of cool stuff on all of those members. So that's there. And you'll fill out that referral form. So if you have a question about what's in that referral form, you can just go peek at it. It's on our website. And that's all this information that's up here in this top kind of gray box, right? Is the information that you put in for the referral. When a client comes in, there are these steps in green. These steps in green are not for the doula. This is for like our internal team. So we make sure that there's an intake coordinator from our team assigned. So there's always somebody to reach out to if you have a problem, if you have a question, if a member ghosts you, or if they move, or, you know, or if they say that their Medicaid plan has changed, things like that, they're there for you. The second is to verify the insurance. We always want to verify that people have the coverage they think they have. So, you know, currently we are in a public health emergency. And so the way that Medicaid has worked over the last 2.5 years has been different than how it normally operates, in that, you know, people are not supposed to be being removed from roles. There hasn't been kind of a re-up of, do you still qualify for Medicaid, and all of that. And then at the same time, in a lot of states, Medicaid has been expanded, right, for a year postpartum. So we've had these two things happen kind of simultaneously. And when that public health emergency unwinds, there's going to be significant impacts to the Medicaid rolls and who's on Medicaid. We will definitely have a lunch and learn about that when it happens. It hasn't happened yet. Does anybody on the call know, did they reapprove for 90 more days? Because it's currently set to expire on October 15th, the public health emergency. I didn't know if anybody.
We have not heard that that's been extended.
Okay,
We've
thanks,
heard the same thing you have.
Yeah, so that's concerning because it's Saturday. So we might have that lunch and learn sooner, because as doulas, so this is a sidebar. So just really quickly pause on the doula learning collaborative and billing, but just as a sidebar, as doulas, as frontline workers, when that public health emergency unwinds, we're gonna want to be really knowledgeable and be able to support families, because if not, people could start losing coverage. It's not going to be instant, it's not going to be overnight, but it is going to be a process of where the Medicaid, the managed care organizations take their entire role and they slowly go through it and confirm that everyone is still eligible. So we'll want to make sure that our clients receive that piece of paper in the mail, that they fill out the forms, that they stay on Medicaid if they're eligible. Okay. So, but we can talk about, Jody, I guess we'll know on Saturday. So, okay. So now skirt back to what we're supposed to talk about, which is the software. So this is what the software looks like. So, okay, so we're at insurance verification. So we verify their insurance. We confirm that they have the MCO that they think they do, that their coverage is current, all of that. Then the next step is to assign the doula. When you fill out a referral form, you will put your name as the provider and as the requested doula. So this will just be an automatic click, right? We won't actually the doula network will not be assigning a doula, but in the software, we will be pushing the button to bring the doula and the member together. And then when you as a doula go on to the software, this is what you will see under review doula notes and close. So this is really the part of the software that you will be utilizing. Okay, so when you log on, you'll be able to see your clients and your clients only. So there's two levels of permission. The first being the facility, this NJDLC, and then the second one being your name. So you'll see yours. If you work in a group or with a partner, then we will know that. You'll let us know either on the referral or once the client's been assigned, and we can assign other doulas. So like, let's say Irene and I are sharing a client, we can both be on that chart. So we can both see what's going on. Okay? So we have the client health history, the little button you'll click, and then this is something that we currently send to members once they're connected with a doula. We send it via text, and Luz, correct me if I'm wrong, only about 20% of the members actually fill it out before their first appointment. So as a doula, your expectation should be that that'll be like your first kind of appointment, first conversation with the client will be around that. We have a communication log, so you'll be able to see any communication that happened, like in step 1, 2, or 3, right? So if there was something funny with the insurance verification, it'll all be logged there, so you'll be able to see it, just so that you know. You also can log your phone calls, your texts, that sort of stuff, so you can keep track of your clients and, maybe start to discover patterns like, oh, she only texts me back after 7, or they're working weekends, so we have to have our appointments on a Monday, things like that. Then down here is where you chart or you document. Sorry, I used to work at a birth center, so I say chart all the time. Really, I should say document. You document your encounters with the member. And so you can add prenatal visits, we have an hourly labor flow. So our expectation, and it's your doula practice, so you're going to decide, but our expectation is that you won't be documenting during the birth or like even during an appointment, right? So this hourly labor flow is literally like what's happening in the room, how is the pregnant person coping? Just so that you're kind of telling the story of what's happening through time. And then the labor and birth summary, there's only one. And so when it's all over, you sit down and you fill that out, right? And that talks about like, did the baby go to the NICU? Was breastfeeding initiated? And all of those questions are just in that one section. And then we have postpartum visits that you also can then document as well. And it allows for start time and end time and duration, which will be important for New Jersey because the way that New Jersey is reimbursing for visits is in units. So, you know, the visits can be up to 60 minutes. That's every 15 minutes, you would be basically billing another code. So I tell you that because as a doula, you know, it's tricky, right? We don't want to be like, well, this appointment has to last 30 minutes, right? But you also don't want your appointment to last 28 because then you're getting paid for 15 minutes, right? So coming into insurance makes us do a little bit of a dance around things like that. And so I'm not putting any judgment on that dance. I just want you to be aware that it needs to happen so that you feel prepared and make this decision to work within Medicaid with your eyes wide open, that you see the positives, the negatives, because it's not, you know, it's not all roses, but it's not all, you know, stinky either. So, and then the favorite button for everybody in the software is care complete. So when the care is complete, and we're working on this button will be available more because in New Jersey, we'll be billing after each visit. You will push that button. We'll know that the claim will be reviewed and submitted by our claims team. So if there's a question, right, if we're like, that's weird, Shanve, you know, said she was there, but then the notes say that she was on the phone, but it says it was an in-person appointment, like those kind of things we can clarify with you. And there's secure messaging in the software, so you can go back and forth and chat about that stuff. And then any updates to your claim would be provided within the system. And then payment goes by direct deposit. So it's pretty quick. We're currently in a claims testing phase. So some of you, I see some names I know, came to the presentation I did earlier this month where we talked about outstanding claims and talking to doulas who have claims that they haven't submitted yet. And we're in the process of collecting all of those, and then TDN is going to submit them. And the reason for that, one is doulas should be paid. That's number one. And then two, it'll allow us to learn any hiccups or concerns or issues that are actually in the system that we don't necessarily know until we kind of pressure test it, until we put enough claims in it to actually see and make sure the system's working. So if you are one of those doulas who's sitting on claims right now, and you're like, well, I'm never going to get paid, please email me, because I really do want to collect as many of those as we can and do our best to see if we can't get people paid. So that is the end of my presentation. We have contact information here. This is the DLC, our website, our phone number. Hello is kind of general inquiry. So if you hit that inbox, we'll send it to the right person. And then Brianna Benton is our chief doula officer, and she'll be supporting doulas with enrolling with TDN when it goes live. So enrolling into the DLC doula group. So that's that was a lot of me talking. So what questions, concerns, comments does anyone have about this process or about New Jersey Medicaid in general? Because I'll tell you right now, you have like all the really smart people on this call. So ask now, because there's some brilliant minds on here who worked through it, including Joni, who's raised her hand. So I'll just let you take the floor on that brilliant people comment.
Thanks, Elizabeth. I'm going to help you facilitate the chat. So Karen has a question for you or us, right? Really, what is the difference between using this process as opposed to submitting directly to the MCO and using their billing codes?
Is that you don't have to submit it to the MCOs if you work with us. So you'll document it in the charting. You'll document your experience, what happened, and then you'll just hit care complete. Our billing team will then apply the codes, submit them, make sure that they're processed through, follow up, do all that work and get the payment. So it's really taking that step of submitting through the MCOs, which I think, Karen, it sounds like you already know, like you have to then go on to either have a billing software or have a biller or go on to each of their individual clearinghouses to submit it. So just trying to take that step out if we can, because it's a lot. It's a lot to hold. So.
Comment too, if that's okay, Elizabeth.
Yeah.
Each MCO is very different too, and I just want everyone to know that these doula services codes are very new, so the communication with the MCOs may not be as strong as other communications in other MCOs. And so, for example, we are in the state of Florida, and our team has just had to have close ties and very strong communication with one of the MCO representatives. And basically it was yesterday morning when she was like, well, thank you all so much for bringing this up to our awareness. They actually changed the code and the reason for why it kept denying, because if not, you just would have been one person having to fight a whole health plan or push through whatever codes need approval or whatever reason needs approval.
It's a really good point, Lou says that. We've really seen and a couple of doulas we've talked to in New Jersey who've been doing the billing through the MCOs, it's hard. It's a lot, a CMS 1500 form has, I think, I don't even know, probably like 100 boxes on it. So knowing what to fill out, what not to fill out, believe me, I don't know. I don't, that's why we have a billing team, and it's really important because they're experts in it and this is what they do. So it's kind of up to you, Karen, the thing we've talked a lot about is we're trying to make this affordable for doulas, but also we understand every penny counts, especially Michelle, your question's exactly online with what we were just saying, when the rate is so low. The rate in New Jersey is entirely too low for the work that doulas do. And so trying to really be thoughtful about that. And also want to create that sustainability so that in 3, 5, 10 years, the DLC can still be here, to support doulas. So, Michelle, as for your question about how did they determine the rate, I don't know. I got here after that. Does anybody else know exactly how they determined it? Shonda, is that why you raised your hand?
So it was why I raised my hand, but I had really the same answer as you. So TDN and NJDLC are independent of the state, although we work closely with the state. That rate was determined prior. So there were different pilot sites that they did use. I'm not sure exactly what information or time studies were done to come up with this rate, but this is why we need more doulas to enroll to become providers so that we can provide them with data to justify a reason to raise the rate. So with Elizabeth software, when they see this is actually the average amount of time that we're spending in a labor support, this is actually the amount of time that we're spending at a prenatal visit or a postpartum visit. So when we ask for an increase, we have the data to back it up to show. So that's a really important reason why we encourage everyone to participate, because we're not going to get anything changed if they have no data to justify and back it up. But how the original rates were determined, no, can't exactly say that we're sure how they came up with that rate, but we're going to try to change it.
Yeah, for sure. And I think, sorry.
Yeah. Hi, it's Michelle. Thank you so much for addressing that. I'm also looking at it from a total panorama view. Are there any doulas on the side of Medicaid to have these meetings or to advocate for us? Because it does not seem to me that they really understand what we do and how it's determined in order to have a fair representation. And although the majority of doulas are what I call the ones in the field, there need to be some type of bridge where these decisions and where these meetings are being made, that our voice is heard and included.
Thank you so much for making that point, Michelle, because that is what we are here for. Everyone on the DLC team, I think for the exception of one, is a doula in New Jersey, operates as a doula in New Jersey. I even bill Medicaid as a doula in New Jersey. And we host a lot of different types of open spaces where we can share these voices. We had a meeting earlier, I can't remember who said it, but I think it was Danica, 2 or 3 people making a noise is not enough, but if all of us do, then we will be heard.
Okay, thank you.
Yeah,
Thank
and you
you.
know, when
Just
we,
to piggyback, I'm sorry, Elizabeth.
go Danica, you go.
Just to piggyback off of what Shani said, yeah, that's why we're here. We completely acknowledge that rate is not, ideal for a lot of doulas in New Jersey. We also acknowledge that, yes, we have better rates than some other states that have this benefit, but we're not satisfied with it. So realistically, we can't expect changes overnight, but please rest assured that that is one of the reasons why we are here and operating as a DLC, is to try to get that rate changed for doulas in New Jersey. Jody?
Okay, thank you for addressing my concern. Thank you.
Yeah. So Jody, what did you want to say?
I more of the same, truly, although to say, I can speak from having operated within one of the pilot sites as a supervisor, and we don't know why the rates were set where they are set either. Nobody knows where they came up with this number. It was not done in collaboration with the doulas. And yeah, to further amplify what Danica and our team have said, I encourage everybody, enroll, and then tell them that they're not paying enough, because who they don't care to hear from are the people who are not enrolling. Enroll and then make lots of noise that they're not paying enough.
Yeah, I agree with that. You know, I'm a huge fan of like the bringing all of our voices together. I mean, that's why I started just the Doula Network. And just so that you have this quick background, is that I owned and operated a freestanding birth center in Boulder, Colorado. And I saw that, you know, midwives are paid poorly, and so are birth centers. And so when I came to this doula space, which is, I was first trained as a doula before going to the birth center space, I just really wanted to take the lessons that we've learned from midwives over the years and from birth centers. And we need to all stand strong and stand together. And then they can't, you know, then we can make the point be made. So I'm really excited to see all of you here. Joni, do you want to go? Because then I want to go back to a question in the chat. But
yeah, really quickly. So we do have work group nominations. And to add to the point of having your voice be heard, one of the work groups is MCO and billing. So if you want to nominate someone or nominate yourself, I'll drop the form in the chat for you to be able to do that, to be a part of the change, and again, get your voice out. Back to you, Elizabeth.
Oh, awesome. Let's get everybody to join. So the other question I think Karen asked was about, do the MCOs require like the documentation, the charting? So technically, no, they don't require that, but when you're working as a Medicaid provider, and I don't want to speak incorrectly because every state has a slightly different rule around how long you have to keep records, but it's usually somewhere between like 7 and 11 years you're required to keep records about members. And you could be audited at any time by the MCO, and they will ask you for proof and documentation of the services provided. And so one of the reasons for creating the software platform was to make that easy, so that it's there, it's being held, will be held to the highest HIPAA standard for across the United States, and also be kept for as long as we need it, so that way, if a doula ever is audited, if they say, hey, when you saw Danica you said you did 4 visits in 4 days. Can you show us those notes? You can just go on, go on and print. And I worked at, as I said, at a birth center for almost a decade. And, our birth center was audited by Medicaid almost every year. Not a full audit, but they'd say, send me 3 to 5 claims. They would randomly pick and they'd say, send them. And so did private insurances. It's a very, very common practice. And so doulas need to be prepared. So if you don't want to use the software, that's totally fine. Just make sure you're keeping your notes somewhere really secure and where you can access them if it's ever asked of you. Because it's just not rare for them to do that. So.
Hi, I have a question.
Yes.
Thank you so much for all your information. So regarding the software, so this TDN software, if we buy the TDN software, so you guys are going to send the claims through that? So the coding and everything,
Yes.
you guys going to do it? And what about the follow-ups?
Yeah, the follow-ups, yes, the claim team will do the follow-ups as well.
Oh, okay. All
Yeah,
right.
so they have like a running, this camera, but like a working spreadsheet where they like follow up on claims every 30 to 45 days. It just sort of depends. And ideally, once we kind of get the hiccups out of the system, because we'll find some hiccups. Of course we will. Like once we get those out, it'll be a little bit easier.
All right.
The system itself is integrated with the claims clearinghouse. So whatever updates that the clearinghouse of Medicaid New Jersey is using, we will receive those updates automatically. So it's a whole technical process that we are working, and our tech team is to create that secure and safe, and also strong communication with the clearinghouse for those live updates. So as soon as it's denied or on hold or pending review, we would be able to view that at real time and then call the clearinghouse or call the health plan and ask them, hey, so what's the delay about? Can you give us an update? So that's what we're really excited about with the software as well.
All right. Thank you so much.
Yeah, you're welcome. It's a great question. Yeah. I'm so glad Lucy's here because she knows like many more of the details of exactly how it works, but it's really helpful to not have to have doulas like going on to these clearinghouses and filling out forms and hoping you did it right and then remembering to check. And it's a lot. It's another job. So I want to be mindful of time. We have 3 minutes left until we have to be done lunching and learning. That's it for the day. We're shutting down both. No, I'm just kidding. So are there any other last minute questions? The slide deck will get sent out. And happy to, anything else anybody wants to ask or know, and we're always available after too.
Sorry, one more question. If we have additional any question regarding this, the software, so can we contact this number, right? 877-436-8527. That's the number?
I did put in my email in the chat for you as well, in case by call I don't get it or I'm on the phone with someone, but I just put in my direct work email for you. So any questions about the software, I'm happy to spend additional one-on-one time. And my email signature, there's also a link for us to schedule this brief 30-minute call, like a video call or a phone call as well. So I'm also readily available to answer these questions for you all.
Thank you.
You're welcome. Well, thanks everyone. This was a really fun day. I'm really excited. I'm really glad that I got to be here. Please reach out. Let us know any questions, concerns, and the DLC will be around. So please join a work group. Let's make our voices heard, right? So thanks everybody. Have a great rest of your Thursday. Pre-Friday, as
everyone for attending. Thank you, Elizabeth.
You're welcome. Thanks, Luz, for jumping on too, and everybody else who commented and asked questions.